So, whenever we see any patient with worn teeth after the age of 19 to 25, then 25 to 30, every 5 years, 35 to 30 to 35, 35 to 40, 45 to 50, it can happen any time. Whenever I see any occlusion with canine tip loss, means no canine tip, there is no canine tip, there should be canine tip, there is no tip. So, canine tip loss, then I see all signs of ocular damage. The teeth are worn completely irregularly. All of them are worn. There's no enamel on many teeth. So this is lower and this is upper. There are worn teeth here, worn teeth here. Okay, and so so when it happens, whenever there's a loss of canine tip, or the front lower or the front upper, the tip should be like this. Upper is there, but on the right side it is not. It is tilted. It is shifted to one. That means it is worn on one side, and the lower tips are not there. Lower canine tips are not there. So there is a loss of canine guidance. So whenever there is a loss of canine guidance, there will be the canine hold the jaw, canine tips hold the jaw, and this does not allow jaw to slide more or deviate more, and it doesn't allow it to collapse. So whenever there's a canine guidance loss, the these are no canines here. When you see there are no canine tips here, no canine tips here, the jaw goes into hit slide beyond limit. And some teeth break and some teeth wear. There can be combination of many. Sometimes patients have symptoms of tinnitus, migraine, headache, muscle pain, clicking sounds, and some people don't have symptoms. It can be anything. But whenever you see a worn teeth with canine guidance loss or canine tips loss, then there'll be high repair and maintenance. Means repair and maintenance means one tooth breaks, you have to get a root canal done. One tooth becomes sensitive, you get a root canal done. One tooth breaks, you have to inlay done, filling. But worn teeth, off and on, those also break. So ultimate aim is to restore the occlusion back to near normal and create the occlusion locks and doesn't allow it to slide beyond limit. They should be we have to create canine guidance. So next step is the step is to check how much it has worn. We don't know. So we check with bite analysis in about 15 days and that the how much they have worn. Once it is done, like in this case, there is a space here. That means this is worn this much. It is worn more here and worn less here. Worn less here. There is no, can see, there is no canine tip here which can stop. So it is sliding more beyond limit and it is tearing off many teeth, wearing off many teeth. Now, ultimate, this is worn, this is broken. So some are worn, some are broken. We don't know. Irregular, it is going to hit a slide. So whenever something hit and slides, one breaks, then one wears, and the process continues. Now, bite analysis is done. We have decided the occlusion level. So we have to rebuild the occlusion by recreating the occlusion locks. So we have to now in this case we have created like this. Can you see this? We have created locks canine tips. There was flat here. We have created canine tips, cusp tips, cusp tips created. It will stop. This in whenever you see a worn teeth, you cannot do alignment. It has to be restorative alignment. Restorative alignment means we are aligning them by restoring them. If they were not worn, we would have aligned them by braces or aligners. But since they're worn, we cannot align them like this. We have to restore and align. We have to refill the space, whichever is worn. In this case, you see, this is not worn much. This cusp is gone, so we will rebuild it or reduce it or depending upon the requirement, we have to place. See, there's a space here, and I will just rebuild it. I need to create an occlusion wherein there will be less hit and slide. When the slide will be less, there will be more resistance, there will be more locks, occlusion locks. The upper cusp tip fix in the fossa, it will not slide. If both are flat, they will just slide. So I have just recreated those by creating the occlusion locks and canine guided occlusion so that it doesn't collapse. This is the way we have to create it now. Now, see, I'll show you on the upper lower. This is the current, and this was the patient came for with the original teeth. When see, this is the original one, and current is we have created locks. This is for the upper. This is for the this is for the lower. This is for upper. And that was for lower. This is worn teeth, worn. They are almost worn here. So we have rebuilt those so that there is less slide, and we distribute the pressure by checking the occlusion forces. Wherever necessary, we divide the forces so that some teeth are meant to take those forces. And we create the guidances, we remove the interference, we create occlusion lock, and that not a hardly a tooth is root canal. Maximum we can just restore them. Restoring them by either composite or with ceramic. In composite, we don't have to grind the teeth. In ceramic, we have to grind the teeth and then rebuild them. So it can be a combination of composite, ceramic, or teeth which are not bone aligners or braces to align them. So minimum our aim is to grind minimum number of teeth. In this patient, since the patient was young, we had to, since it was a lot of teeth or bone, we had option of restoring them with composite or ceramic. But a long-term solution is ceramic because the teeth were worn quite a lot. So if I had restored with composite, it would not have lasted for a long time. So in this case, we restored with ceramic lower and some teeth composites and some ceramic. This is composite, this is composite, this is ceramic, and this is ceramic, and this is ceramic. We haven't shaped out the enamel. We just placed a layer behind and some occlusion with composite. See these. We fill them with composite. We fill them with composite. We fill it with composite. So we did not grind those teeth and we just filled them. With composite, but composite life is less, ceramic life is more. So depending upon patient's requirement for occlusion pressure distribution and the age of patient, we use different tools. Tools are composite, ceramic, or braces or liners very rarely. Now, we ultimate aim is reduce the hit and slide to minimum. Now, again, these will wear because the patient will eat. So, but what will wear is in case of composite will wear, tooth will not wear. In case of ceramic does not wear easily. Very rarely it will chip out because now the pressure is more, slide is less. They will not chip or they will not require frequent treatment. Some patients who have symptoms of tinnitus, migraine, and headache or clicking joints, they slowly go down. So patient gets relief of those symptoms. So they can be symptomatic patient, non-symptomatic patient. But bone teeth, we have to consider restorative alignment, not simple alignment.